folks joining in. The probably reality for the moment is I know the governor had another issue, and I don't know for sure if the governor will be able to make it on, so we'll kind of watch for him to join. But first of all, I wanted to point out that the Q&A function is actually working in this today, so you're welcome to enter a question into the question and answer, and I should be able to see it. Hopefully that all functions and works right. But certainly as we go along, if you type your questions in there, we'll try to answer at least some of them as they come up and proceed as we go. But I appreciate again everyone being on. I'll go ahead and maybe kind of go to the next slide. I also am expecting some of our public health folks, and I don't see that they are on yet. So we'll kind of proceed and come back as they come on. I would point out, just so folks kind of get a sense of the ongoing gravity of this, if you look at where we were at last Monday, we had about 1,300 cases, and today we're up over 3,000 cases in the state. And so we continue to watch that kind of trend in Nebraska go up, which is, I guess, somewhat expected, that we maybe are 2 or 3 weeks behind the rest of the country as far as hitting our peak. And so we'll certainly come back to that if we get any of our health folks on. But I thought it'd be worth jumping into the call or into the rest of the conversation, and we'll see if we pop into the other parts of the session as we go. So anyway, so kind of next on the slides, we'll start to talk a little bit from the perspective of I'll go ahead and jump forward to the ESU, or the next slide actually, Zainab. So kind of comments from the field, and then we'll come back if our health folks are able to join us in a little bit. So what I wanted to talk about with you, starting with, and we have Andy Rickley and Caroline Winchester on with me today. I appreciate both of them doing that. I appreciated last week that we had a bit of the conversation with a couple other superintendents, and thought it would be a good chance to kind of talk with all of you together relative to the kind of current state of things, and appreciate both Caroline and Andy being on. And I think you should be able to unmute your own microphones if I'm not mistaken. If that doesn't work, let me know. But appreciate both of you. I thought it might be helpful to talk a little bit about kind of the end of the year and the types of questions that you both might have, but we can certainly kind of talk through that. And I appreciate both Caroline and Andy being on. Andy, I see you're unmuted. Is there any kind of the state of affairs in Papillion La Vista, and probably pretty representative of the area and probably the state? So how are you doing?
Thanks, Commissioner. Can you hear me okay?
I sure can.
Well, happy Monday, everyone, and greetings from Sarpy County. I don't think we're probably doing a whole lot different than what all of you are doing. I'll certainly touch on a couple of things, and if there's questions or comments, I'll do my best to answer. Some districts across the metro, across the state, have decided to end their last day of school early. As of today, we have not decided to do that. We are staying with May 22nd, so we're going to keep on trucking to the end of the year. One of the questions we've been struggling with internally is to what end, at least for us. And certainly there's a lot of really good reasons to end the school year early. I certainly get that. But for us, we're going to keep going until May 22nd. One of the things that we're struggling with, that I suspect many of you are, is how do you get stuff back from kids, whether it's technology, textbooks, sporting uniforms, things like that. So we're still trying to figure that out, but to the extent possible, we don't want our kids coming back on campus. I mean, the governor made that directed health measure for a reason. And if it's not safe for kids to be at school, we're not sure it's safe for them to be, even coming up to the building to drop things off or pick things up. So to the extent possible, we're trying to minimize that. We're also staying with our policy to keep our playgrounds closed. I think this is consistent across the state. You all can tell me if I'm wrong. The city of Omaha did reopen its playgrounds and its parks, I should say, this last Saturday, but I believe outdoor playground equipment is not included in that because the cities can't keep stuff sanitized in between kids and families playing on it. So we will very likely keep our school playgrounds shut down for the remainder of the school year, again, May 22nd. And then the last thing that we've been talking a lot about as a district, I don't know how much of this applies to all of you, but we have a foundation, we have a before and after care program, we call it Kids Club. It shut down along with the school district when we came off of spring break. And our foundation, frankly, is bleeding money. That is their main source of revenue. So we're having conversations about how do we allow our daycare centers essentially to reopen so that our foundation can do what it needs to do, but above all, public safety has to be the primary consideration. I think those are the big things, Commissioner. Again, I hope I touched on the right things, and I can certainly go into greater detail if anybody has any questions.
No, I appreciate that, Andy. And obviously, as we keep talking, I'll have you chime in as you see fit. So, and then Caroline, would you like to kind of speak to your same kind of perspective on how you're ending the year out in Chadron and, you know, kind of how you see the world at the moment. So.
Well, greetings out here from Dawes County, where we have more cows than people, and so it's kind of a good thing during this time that we do have more cows than people. But no, I appreciate the opportunity, and I would echo what Andrew said on many fronts. We're sticking with our May 22nd date for the last day. I know the high school principal is working on some videos to make some special moments for the seniors, you know, for honors night, a celebration piece. The community has really stepped up, you know, to try to honor our seniors. So both radio shows on our graduation date of May 9th are going to have special celebrations and broadcast the speeches from the valedictorian and salutatorian. So the community is doing a lot of things like that, and so you know that's kind of consuming, you know, that piece. But you know, we've been really blessed, I think, in a number of ways. This has been a tragedy, but at the same time, I've seen so many blessings. One thing was the ability, we chose to keep our buildings open, and staff chooses whether they want to work from home or come in. But there's just been, I think it's been good mental health. I mean, when I walk through the buildings, I don't think I've seen people happier in some ways. They're, you know, it's for the staff, it's part of their mental health to be able to come in every day, especially our hourly workers. And they've become very creative. They've taken leadership roles. Our buildings are going to be cleaner and brighter and safer than they've ever had. They find things to do, and they've been stepping up. And so that's been a real blessing, you know, having the time to do some of these things. I mean, it's been a challenge, like everyone else. You know, we rolled out mastery learning, we rolled out remote learning, and we did all of this without any training for staff and so forth. And I think that's, you know, the lack of, you know, we can start to see it now. I think some people are, you know, kind of hitting the wall, and my building principals have to keep meeting with teachers and tweaking some things. But it's just been amazing, and just a real blessing, like I said. And the creativity that I've seen. We have a after school program, and of course we've had to shut that down, but in the summer we do some summer camps. And so on the creativity end, we normally have a summer camp for our intermediate building, 3rd and 4th grade. And so they're not going to, I mean, they're not going to have a physical camp, but they're going to have a remote camp and put together science kits that the kids can pick up and do experiments and things like that. So, you know, that we're working with a difficult situation, but like I said, in some ways I haven't seen staff happier. And I appreciate the governor and being allowed to keep our buildings open. I think with everybody, that there's the concern, about what next year is going to be like. And I think everybody is suffering from not being able to control things like they want. And so I think the one thing that I've heard over and over again for you and the governor to keep in mind is that we were blessed this time in that the timing was, we had finished third quarter and it was fourth quarter. We've already established relationships. But going into fall is going to be first quarter where we're needing to establish those relationships with kids. So as you get closer and when making decisions, I know that I would echo just if there's some way we can open with kids, and it may not be the same for everybody. That's what I'd like to caution too, because we're blessed out here. We don't run bus routes. We're a school district of 900. So I mean, if we had to go with only 10 students in a class, my building principals have already figured out schedules. We can do that, but not everybody across Nebraska may be able to do that. So I just would ask for, I guess, some, allow districts to kind of, follow whatever the public health rules are at that time. But if there's some way we can start with kids, that's the one thing I've heard from teachers and administrators. That's what they'd like to see. And that's their probably number one concern.
All right. Well, and thanks, Caroline. I think one of the things, and I do see we have Michelle Beaver and Teresa Anderson on from our local health folks, and I'll come right back to you. But there are like a couple of questions I think I'll explore while I've got Andy and Caroline still on. One's a point that Caroline just started to raise around summer school and what that looks like. And I see a couple questions related to summer school and also kind of the types of activities that might be able to take place during that point in time. And I think one of the challenges obviously that everyone's having is figuring out how we can use summer to help us with those kind of transitions to the fall as well. And so one question we had was a little bit about seeing kind of the recent directed health measures and the kind of the approaches to trying to open things, what that signals to us from a school perspective. And maybe I'll come back to Teresa and Michelle on this one a little bit, but what that might signal relative to how we should be thinking about the summer and the fall. And then also, I'll probably come back to that. And I am hoping still that maybe if the governor is able to join, I can hit the one about graduation and what the DHMs might mean for us in that space. But Caroline and Andy, like on the dynamics of summer school, where are you guys at for thinking through any of those types of topics, and how can we be helpful in thinking further on those fronts for you? So,
Dr. Winchester, do you want to go first on this one?
Yeah, I was just going to, thank you. Yeah, I think what I'm hearing from my building principals is if NDE can give us some direction, especially with, the reading initiative, are we expected to measure progress with the students that are behind, or is it more of an enrichment piece that we can do? Because some of the things that we were going to incorporate our summer reading part as part of our summer camps, and obviously we're, with the exception of the science one that's rolling out kits remotely, that's not going to happen. We also had we're going to work with the public library on some things, and the public library shut down. So I think if the department could give us some guidance on like the expectations with the reading bill, like I said, are we expected to measure progress of these students, or is it trying to provide them with resources and enrichment?
Yeah, and I think we're going to come back to a little of that topic here in a little while with some of our team. So that kind of highlights one of those questions that I think we want to try to address. And then, Andy, did you have something else you were contemplating right now?
Yeah, thank you, Commissioner. Very, very similar to what Caroline had said. We're trying to really emphasize with our parents and our community and our staff that our plan is to open up on time, on schedule, face-to-face. I was thrilled to see that UNO, the University of Nebraska system, made a similar announcement that President Carter had said, our plan is to have students back, not online, not remotely, but face-to-face next fall. And we're trying to take a similar approach. But summer is certainly on everybody's mind. We run really 2 programs during the course of the summer in most normal summers, and we're going to try to do both. First is summer school, at least for elementary. We're going to continue to run summer school. This isn't finalized yet, but we're going to go virtual, and the focus will be on reading. Other districts across the state, I know you do reading, you do math, you do high interest, exploratory, HAL, gifted stuff. We don't really do that, and those are all really worthwhile programs. We've chosen to focus on reading specifically, and I suspect that will be our focus for this upcoming summer. Certainly something that's consistent with what the Reading Act requires. The second part of our summer programming is for our incoming kindergartners that meet a number of criteria. We call it Jumpstart. We've had some really, really great success with it. Typically identified students that either have low income backgrounds, single parent households, some type of at-risk factor. We bring them in early and prep them on everything from here's your expectations when you walk into a school building to what a classroom looks like. And our success with those students that participate in the Jumpstart program has been really pretty remarkable. So we're probably going to bring that down to just a handful of days instead of a week or 2 experience, which it typically is. So again, we're trying to find that happy mix of bringing people together face-to-face where it makes sense and it's consistent with the DHM, but summer school will clearly be more of a remote virtual kind of experience.
Yeah, and thanks for that, Andy. I think I want to go ahead and transition back to Teresa and to Michelle to talk a little bit on the local public health side, and appreciate you both joining, as I know it's quite busy and we think of your world all the time. So really, I want to turn it over to you, and we'll come back to some of the education issues and questions. But both Teresa and Michelle, thanks for being here. I don't know who wants to try to go first, but I'll see who unmutes first, and then I'll know, I guess. So Teresa did. Yeah, very good. Thank you, Teresa.
Michelle, you go first.
Oh, you want me to go first? Okay. Thank you all. Thanks for having us on as well. I'll just give a little update for South Heartland. We are Adams, Clay, Knuckles, and Webster counties. ESU 9 covers all of our counties plus a little bit of Teresa's area as well. We had our first case on March 18th. Since then, our total is now 136. That includes 128 in Adams County, 5 in Clay County, and 3 in Webster County. We've had 2 deaths. Our second death we announced yesterday. We've also had 75 people who have recovered from COVID-19 disease. So that we are trying to report that good news as well. We're also doing some tracking of demographics of our positive cases. And we have 54%, this was as of last week, 54% were male and 46% female. Actually, the highest percentage, if we look at age in decades, the highest was the 50 to 59-year-olds at 20%. And then the 20 to 29, 30 to 39, and 40 to 49 were each equal, and that brings us to about a 50% total for all 3 of those decades. We only had 1% in 80 to 89 and 1% in 90 to 99, so that makes us feel like we're hopefully doing a good job protecting our elderly population. Another thing that we're tracking is the symptoms of our COVID cases to see what the most common symptoms are. And we're seeing that cough and fever in our population is highest. 60% have cough, 60% have fever. And then it kind of goes down the line of fatigue, congestion, diarrhea, shortness of breath, runny nose, headache, sore throat, nausea and vomiting. When we get down there, 20% of folks have some of these body aches. Loss of taste and smell, 11% of our cases have that. We've had about 9% hospitalized. 5% of those tested are asymptomatic. And you have to consider that we're only testing those that are usually with symptoms and more sick. So if we were testing the general population and doing random testing, we might see more of the asymptomatic, but of those that we're testing, about 5%. So we're tracking that. And then we're also looking at demographics in terms of race, ethnicity. And to date, we have about 37% Hispanic Latino and 30% white and about 6% Asian Pacific Islander. We're working hard at actually doing a better job collecting that information. So right now we have an unknown of about 20%. So we're working on that. But one of the things that I wanted to talk about is that we're also doing more testing. I think testing is critical for us to make decisions. And so we have the National Guard here today and tomorrow doing additional testing. It'll be 300 tests total for the 2 days to get a better idea for some of our critical infrastructure, which includes our food processing plants and some other manufacturers, as well as long-term care and responders. So we're working at getting some more results there. As we do more testing, we'll have more positives, but actually what we're trying to do is look at the rate of positives, so the number of positives per number of tests, so that gives us an idea whether we're having an increase in positives, or when we're back on the other side, as it's reduced, then that'll help us make decisions about statewide about whether we can relax directed health measures or not in certain areas. So starting to look at tracking that a little bit more. The couple of questions, we've been meeting with our ESU 9 schools and then the daycares and childcare facilities in our area weekly for quite a number of weeks. And those have been, I think, helpful for us gathering information from the folks out in the field and working with kids, but also hopefully for them as well to get some information and share information across the area. I think it was really helpful, Commissioner, for your letter talking about graduations. I think the feedback the last week was that it was kind of a relief that there was some guidance that was going to be consistent across school districts and across the health district as well. Couple of questions that people have are related to some other states are, like I think it was Colorado that was mentioned, is not going to start in person next fall, but waiting till maybe mid-year to do that, and wondering whether Nebraska is considering the same thing or whether they should try to ramp up for in-person or continue on. And I think one of the other ESUs talked a little bit about that. Another question was about what we think in public health about when the next wave is going to be, second and third waves, and how that can help us make decisions. And that's a really tough question, and I'm not sure how to answer that, but I think we do need to keep that in mind, that a lot of it's in flux based on how we respond to this disease and how it responds to the things that we're doing. And I don't have an answer for that, but I just think we need to throw it into the mix of questions that we're considering. I think that's all I have. If there's anything else, Commissioner, you'd like us to talk about from our district, I'd be happy to do that.
And I think I'm going to turn it over to Teresa, but I'm just going to name a couple of the questions that I might come back to a couple that I see. One is, what's the best guidance? And I'm not asking that you actually have to answer this right now, but for allowing students back in the building to kind of check out for the year. I mean, so give that a little bit of thought and we can talk about that one. And then I appreciate you mentioning around graduation. There's one I'll kind of come back to Michelle and Teresa after Teresa's done kind of presenting. So all right, Teresa, and thanks, Michelle. So Teresa, go ahead.
Yes, and thank you for giving us the opportunity to share what we know, what we think we know, and probably what we don't know, most importantly. But over here in our area, the 3 counties, Hull, Hamilton, and Merrick, we've had quite a run with COVID. We have 954 cases, and we've had 25 deaths. And those are spread out. We've got 899 cases today in Hull, 47 in Hamilton, and just 8 in Merrick. One of the things that we had early was community spread. We didn't have any individual who had just traveled here from overseas or who had visited a sick person in Omaha or wherever and brought back it with him. Our first knowledge or first positives were 3 individuals that were unrelated, had not traveled, and had not been around close contacts. So we had community spread from the get-go here, and it spread, it did. So we just could not contain it well at all, despite all of our efforts. We have, as you all know, a fairly large Hispanic population. We also had a meatpacking industry, and any number of factors go into determining how that interaction plays out. For us, it did not play out well, and we've had a significant percentage, which we're not tracking anymore, but at some point we had a good share of people testing positive early on that were JBS employees. And I always have to go back and explain that it doesn't mean that they got it at JBS. It means that they had that common factor among them, and they had other common factors as well. If we had had time to go back and research it and look at it, which maybe someday down the road we'll be able to, we could probably find all kinds of links that would help us establish the connection and why we had so many cases so quickly. But for right now, what we're doing is working on, we're still deep in it. We're not even nearing where we think that we're at the end. I had thought we'd probably be in about week 4 now, week 4 or 5 now. You can tell we're tired, but we get 70 new cases every day. Today we only had 25, but that's simply because there was not a lot of testing done on Friday and Saturday. So we have DHHS coming in they started this afternoon to help us with those case investigations, because we want to identify the individual who's positive, but then we also want to identify all of the close contacts that person has had and work on quarantining those so we can slow down the spread. We're really glad that school was ceased when it did, and we're glad to see that it will stay that way for a while. We, like South Heartland, have closed our parks, which was really heartbreaking for those of us who want these kids to get outside, left our hike and bike trails open. Our biggest concern right now is our long-term care facilities, and it's very frustrating to us that we have over 125 either patients or residents or staff that have tested positive. And it's very disheartening, because it appears that once the COVID virus gets into the nursing home or the long-term care facility, it's really difficult to contain the spread. So that's one of our biggest challenges right now, and I don't know that we're going to win that one, sorry to say. Our testing has been about 35% positive all along the way, which means, and actually I think we were at 45 for a while, so of every 10 people we tested, 4 or 5 were positive. So terrific spread, and we're just trying to do the best we can to contain. We have some new ideas that hopefully will, and some new opportunities, some new offers of help that will help us to get testing more, because if you think about it, we've tested maybe we've had 2,200 tests, something like that, and 954 positives out of that. So 2,200 tests out of our 78,000 population, not that many tests. So we've been begging, we continue to beg for more tests, and we know that they're coming. We'd like to see them sooner rather than later. We're working hard to maintain social distancing, and this warm weather's fighting against us too, like everything it seems to be. And we actually said today that in our community, we don't think it's time to go to church yet. Not that we have anything against church, just that because the spread is so pervasive, that we're asking people to wait 2 more weeks before they consider attending religious services and continue to do what they've done in the last month to kind of help us reduce that spread. As Michelle said, I think we don't know what's coming down the road. We don't know if we'll get past this one and then get hit again right away, or if we'll get a couple of months off. It's a brand new game, and we're just trying to do the best we can with it, but happy to answer any questions.
So thanks, Teresa. I mean, maybe a couple things, and I just see somebody had posted a question asking about how kind of the meat processing plants are doing, and whether or not there's any intention to actually have them close, or I don't know if you want to talk through that, or if you're willing to talk through that.
I can tell you what we're thinking here because we've given it obviously a lot of consideration, and hindsight's always 2020. We know that Grand Island is pretty far ahead in the process from some of the other meatpacking plants in Nebraska by virtue of our numbers. And so what we're trying to do is share what didn't work so other people can employ that. And I think that maybe an early shutdown, I know an early shutdown could be beneficial. I'm not sure what good it's going to do us at this point. And you all know it's the same when you close the schools. Where are the kids going to go? When we close work at JBS, where do the families go? What do they do? And we know that our Latino families like to spend time together. And by closing the meatpacking plant, are we actually encouraging more of that group gathering? You know, there's so many factors that go into this. So at this point, we have been meeting with JBS on a very regular basis. And we're working with them right now to come up with a plan that would increase the level of testing that we're able to do there through some good opportunities that came out to us on Friday. The more people we can test, the more we can isolate. If we could actually test every employee and their family and determine if they need to be isolated, quarantined, or maybe later on test antibodies, these are all things that we're kicking around with a project that would be guided through Nebraska Medicine. And so and the College of Public Health. So we're looking at some really innovative ways to learn from this so that it will be beneficial to the other plants that are just starting to see the rapid increase in number of cases.
So thanks for that. And then maybe just for Teresa and Michelle, I mean, so like questions about, you know, how or if to let students in to kind of close out the school year in the sense of picking up materials or anything. Is there any general guidance? By the way, so folks understand, I'll be on the call with the local public health folks and the governor tomorrow as well. So I can raise some of these types of questions in that setting, but I don't know if Teresa or Michelle, you want to weigh in on that question, or we can punt until tomorrow and have a bit more dialogue on that one. So I think that's punt and wait till tomorrow. Oh, maybe Michelle.
Yeah, I was just going to say that some of our schools had some quote unquote close out when they shifted from in person to online or for distance, and they had some processes where people came in with their students and were separated and picked things up. So there may be ways to do that
Okay.
at the end of the year if there's additional kind of end of the year sorts of things to do. But again, we want to make sure that the social distancing and the gathering and the potentially masks this time and everything would be followed.
Yeah, thank you for that. Well, I appreciate both of you being on, and if you're able to stay on, that's wonderful to kind of hear the rest of the conversation. And I do know that I have questions. Folks have asked more questions about graduations with the recent opening or changes in opening, and I suspect we can kind of take that up tomorrow when I'm gathering with you again to see if there's anything else that we need to do on that front. So I'll move on to the kind of the next topics with the ESU folks that are on. We got Dr. Craig Lofquist and Dan Schnoes on as well. So thanks for you both joining. And I just had a couple topics, and you're welcome to either ask me a question or give the kind of context. But the couple things I just want to, I guess, maybe first mention is to appreciate and thanks for everyone continuing to have regional conversations. That's been really helpful for the department to be able to then take those regional conversations and distill them into, hey, look, what are some main themes? And so just thanks the issues, part of the work that we did last week in releasing a letter from me with a little more clarity around some of the Rule 10, and that guidance came as a result of those conversations. So thanks, Craig and Dan, and all of your ESU colleagues as well. So Craig, you want to add to?
Yeah, thanks, Commissioner. Really appreciate the work, giving us an opportunity to speak. We continue to have those regional conversations. We meet every Tuesday afternoon and Friday morning. It's been very helpful and beneficial. One of the things that I don't know if everybody knows, is that every now and then you are able to join. We know that your schedule is very busy, so we appreciate that. You were able to pop in for a while on Friday morning. And when you can't, some of your cabinet members attend. So that's been really beneficial. And then the email and the communication that you had talked about or alluded to this last Thursday, I think was really helpful. I think Dr. Snows is going to talk a little bit about the end of year reporting and guidance. We do continue to put down the questions and answers in a document, just, as an FYI. And then I know that you're aware of this last one, and this is probably a conversation for another meeting in a week or two. But I've been involved in a number of conversations regarding access to online instruction and delivery. I know this isn't new to you, but what has shocked me is the number of groups that are involved. I did not know until last Tuesday that there's actually a bill, LB 996, Senator Brandt's bill, to gather information. And I know the department, through their Future Ready work, has a lot of that information. But I've been kind of surprised at the number of groups that want to do that work and be involved in it. And right now, in my words, off the top of my head, is kind of disjointed. And so a collective effort or collective impact as we move forward would probably be beneficial. That's all I had, and I would ask if Dan Schnoes would follow up.
Good afternoon, Commissioner. I know we've been talking about this for the last few weeks, so we sure appreciate you getting the email out last Thursday on the Rule 10 accreditation and summer learning. As you know, Dr. Winchester and Dr. Rickley were showing, we still have a few follow-up questions, but I think everybody's trying to do what's best for kids, and so those are some really great questions that they're asking. And believe it or not, we are all actually looking forward to seeing the affidavit and the Rule 10 checklist, which might be the first time in the history of the state of Nebraska that somebody actually would like to see the Rule 10 checklist. And so just a couple of quick questions is, first of all, I think in your email said you were hoping to get it out by May 4th or a little earlier, just checking to see how that's going. And then the second question was kind of goes along with that. There's a few other rules that there's going to be some questions on, I believe, as well. And will there be some follow-up checklists that'll be coming for those additional rules?
Yeah, and actually, it's a great questions. And I'll even on Craig's point about kind of the digital learning pieces, we might talk a little bit about just some of that later today in the department's update. But Craig, I think that points out one of the things our staff has pointed out as well about how to kind of get our arms around some of those topics where I always call that a little bit of that popcorn effect. Things just start popping and you try to get it contained again. And so we'll certainly work on that. And then Dan, to your point, yeah, number one, never have so many people come to me and say, provide us the regulations, which we move forward. And so I suppose that's a unique moment in time, but we will be taking on those types of topics. In fact, I hope to kind of gather up the next list of questions and appreciate again from the ESUs. I had one topic pop up with Superintendent just asking, for instance, right around, do we have to do standards adoption on social studies standards right now? Or could we have another year? So we're going to be trying to offer flexibilities around all those things. There might be a couple new tricks we have to learn from a kind of a perspective on those topics, but I anticipate taking that list of kind of maybe unanswered, perhaps smaller kind of policy pieces compared to the Rule 10 checklist, and putting those together in the next week or so as well. So we can actually have something there. The state board does meet actually next week, and I know I've got some board members on today. We actually have some committee meetings, and we'll be talking through some of that in order to make some, kind of further points and decisions on those fronts too. So we'll kind of keep ticking those off, and like by the May 4th timeframe, which is just next week, I think. So I anticipate that timeline will stick, and we'll be able to get moving on that front. I will just highlight kind of last in a transition here, maybe to the NDE side. Our staff has been doing a lot of work, and we have the continuity of learning plans that ties to that memo or letter that we sent out last week. Really, I've seen that as a kind of a holistic process to get us through the year, and we've been having to learn how to manage that in this setting, but appreciate it, all the schools' attention to that and all the help that we've had from ESUs as well. So we'll kind of keep that moving. Again, thanks Dan and Craig and all the ESUs for kind of that ongoing help as well. And we'll go ahead and move to NDE highlights. There are a couple more questions I haven't gotten to yet, and a couple questions that I think we'll actually be able to address in these conversations. So if we miss something, we are keeping track of it, and we'll find ways to get those answered too. So thanks for your questions. So I'm going to start with Beth Wooster to talk a little bit around the fiscal waiver, and we also sent that out last week too. So Beth, thanks for joining, and go ahead and share a little bit about what that waiver means for schools. So.
All right, thank you, Commissioner. Good afternoon, everybody. I just wanted to let you know that the letter did go out last week. Commissioner sent it out that Nebraska did receive a waiver for the ESCA federal programs, got the fiscal waiver so that any funds that were carried over from 18-19 now have another year before those funds have to be liquidated. So instead of them dying, for no other better word, they can go all the way till September 30 now of 2021. So they have the same deadline as the 2019-20 funds. Also, the 15% limit on carryover for Title I was lifted for the 2019-20 year so that you can carry over more funds than what you could in the past. And then also some programmatic changes happened with Title IV, the minimum thresholds for Title IV with the 20% of well-rounded, 20% social emotional, and a minimum percent for technical or technology was lifted so that now that districts can use them however they best see the need. So also the 15% limit for technology infrastructure was lifted. So if a lot of districts were having problems getting hotspots or getting technology to students, that has been lifted so that those funds can be used however the district sees they need them the most. And then there was also on professional development, there was some information there. So if you have questions on any of the things with the ESCA federal programs, now IDEA was not included in this extension, but all of the other ESCA federal programs were. If you have any questions, my team is more than happy to help you and answer your questions.
So thanks so much, Beth. And I know we probably, the big one I think was the timing of funds, right? I mean, that the current year could be extended. And then there's some flexibility around how they can spend those funds on kind of immediate needs, correct? So
yes.
Yeah, so thanks for that work, and stay on in case folks start asking us questions here. So I'm actually going to move on to Rule 10 and accreditation. So Brad Dirkson's on, and you've heard a little of the dialogue already, Brad. So I hope well, if I stole any thunder, I'm sorry for that. Anyway, so.
Thanks, Commissioner, and still all the thunder, that's fine. I think the Commissioner's email last Thursday was really good in outlining the process. Went out to all superintendents and also to ESU administrators. So if you haven't read that, please refer back to those emails. It kind of outlines the process all right there, but I can always help answer questions and concerns. But really, we're trying to make it as simple as possible. We're trying to make it one process, as the Commissioner alluded to earlier, and we want to make it not a time-consuming process too. So we're looking at a half an hour approximately or less to complete the whole process. And really what it is, it's going to be a follow-up of the continuity of learning plan via an online form, and then also a Rule 10 checklist, kind of inquiring about what kind of struggles we had with those particular Rule 10 checklist items, not from a punitive side, but more of an inquiry side of how can we look at the rules and regulations going forward for this next academic year. And then also the end of the process will be the ability to upload or attach a PDF copy of your affidavit. The department's putting together an affidavit and also this online form, and we're on track to meet that timeline as the commissioner put out into his email.
So thanks for that, Brad. And so pretty much still the timeline that we've outlined is what we expect to carry out, and appreciate your work and the team's work on those fronts too. So thanks for that update. I'll go ahead and move on to Bryce, and I'll keep watching if questions are popping up. Bryce, I did have one question that maybe is a maintenance of effort one. And then I think I got a text talking about bus contracts and otherwise. So just to forewarn you, I'll probably hit you up on those two topics. So.
Sure. Well, I was going to quickly first mention, we're getting a lot of questions on transportation around several of things where level training's expiring for our drivers. What do we do? Just want to make sure people know that the Safety Center is offering level 2 training. They have been offering level 2 training remotely. We've actually been working with them, and just starting, I think this upcoming week, they're now offering level 1 training as well. So if you have new drivers coming in, they're going to be able to take level 1 training online as well. So we're trying to get that. They're beefing up and adding more classes so that we can make sure these drivers, as their level training expires, they can get their level back up and on, I guess, active. One thing we did work with them on is if you do have people that can't take the virtual remote class for some reason, for whatever that be, we're encouraging you to try and get them to do that so they're ready when this all expires. But we have worked with them to create a 60-day waiver where once their classes start back up again, once they're allowed to have in-person classes, any drivers that had level training or the 60-day waiver expire can take that level 2 class instead of having to go back and take level 1. What that doesn't mean is they can't go back, that they can't drive until their level training's up to date, but they just don't have to go back and take level 1. Also, if their medical exams are expiring, the Federal Motor Carrier Safety Administration has provided a waiver through June 30 for that. So if their CDL won't expire on them and they can keep driving. The governor's executive order also provides an additional 30 days after the health initiatives have been expired. So whichever the DMV is operating under, whichever of those is the longest. So that way, your CDL drivers can continue to drive there. And then just vehicle inspections for the fourth quarter. If you're not using your vehicles, which most schools probably aren't for transporting any students, then you don't have to have your vehicle inspections for that fourth quarter. But if you're going to use those vehicles during the summer, or anytime between now and then, you'll need to make sure those inspections are completed. And then again, before school starts. And then the last thing on the drug testing question that we're getting, you will still have to meet, the Federal Motor Carrier has said they will allow you not to hold those, or if you can't meet the drug testing for this quarter, that's fine. You can provide written explanation for that, but you will have to hit the same requirements by the end of the year. So basically, if you can't do your random drug sampling on your drivers right now, that'll have to be made up once the restrictions are lifted. Did you want me to touch on those other questions now? Or?
Yeah, I mean, so I don't know if you want, which one you want to take up first. You want to talk bus contracts and just kind of it's the purpose of that. Yeah.
Okay. So some of the work we've been doing based on the commissioner's guidance, also information we're seeing from the CARES Act, which some additional information was released on Thursday and Friday of last week. We're still waiting for more information that was potentially going to be released today. I haven't seen it yet though. But the CARES Act is requiring schools to make efforts to pay all their employees and vendors. Busing vendors being one of those, school food programs being another, sped paras. There's been a lot of different ones. A lot of questions around what is a vendor. I think that can have a pretty broad definition. I would focus mainly on those ones that you have continued contracts with, where they provide services that's going to continue year after year. Busing being a big one. I think it makes sense when we worked with some of the school attorneys to try and provide or work to get to a situation where you're paying those vendors amounts to get them back and kind of set whole so that they're not profiting. Obviously, they're not going to have certain costs during the shutdown either, like fuel, if they're the ones paying for fuel. Some of their drivers have taken unemployment and they're not paying them. You shouldn't be paying for those situations, but we're trying to get schools to follow the CARES Act, and really just to keep all their employees on, knowing that taking a long-term approach to the situation usually is going to end up saving school districts money in the long run anyways, where you're not trying to hire or find new vendors come fall. So that's been the guidance we've been trying to get, I guess, people to follow and working with school attorneys on. And I'd be glad if somebody has a question, I could be glad to just talk to them if they want to give me a call or shoot me an email at any time.
So Bryce, one question popped up, and it's about will schools be able to use school transportation when routes definitely exceed 10 people? And I don't think we've had any discussions about that publicly anyway that I know of, or you and I even. So we'll have to come back to that one, I suspect, right? And as we go. So maintenance of effort, do you know anything on that front where we're at? I think they're probably talking IDEA maintenance of effort, but I'm not 100% sure.
That would be my assumption, and I have not yet heard any guidance from the federal government on maintenance of effort yet. So nothing, no new news there, I guess.
All right, we'll come back to that one when we know more. And then on the safety of number of passengers, we'll have to come back to that one, but we'll mark that note too. So thanks, Bryce. We're running a little low on time, but I think we're really down to the last topic or two. So Dorian is up, and thanks, Dorian, for joining.
Yeah, thanks for having me. I just have a couple things, and to speed up time, I put 2 links in the chat that you can just save and check out later if you like. A couple of new things on the e-learning days page. There is some guidance around student data privacy and data security and data governance, and some links to some resources that can help you rethink those plans or build plans if you don't have them. That page will continue to grow. We will continue to add resources that you can use through the summer and possibly down the road. The other things in that page at the bottom of the main e-learning days page is a link to OER resources for all content areas. Know that all of those have been vetted. They are all compliant with the federal privacy laws, all 5 of them. And they also follow Rule 6, which is linked in the new pages that I gave you, and to state law related to the same privacy issues. So teachers and anyone else that's working with students, parents, they can use those and know that those are safe for students to be using. They're not just great for this type of learning, they're great resources for any type of learning. So even when we return to the classroom, these might be resources your teachers would be interested in using, and many of them are very high quality resources. In addition, the second thing I put there is we are revamping the Future Ready Conference that will need to be virtual, which I'm sure is no surprise. And because of that, we're changing up. The focus will be on help for remote learning for teachers, librarians, school leaders, technology folks. So we intend to provide resources and some professional development around all of those topics, as well as social emotional learning will also be included. It will also be absolutely free for everyone to attend. And we will record the sessions as well. It's June 15th and 16th, and the link is there to get registered to attend that event. And that's all I have from the e-learning front.
Thanks, Dorian. And just so folks know, kind of pay close attention, I think, for the next few days, as we're really starting to try to roll out a sense of how we can be assistive in everything from what Craig said around technology to the types of supports for professional development and the resources that'll be there for online learning. And so thanks to Dorian everyone that's been working on that. I will tell you, we have school folks working on those fronts too, and so those partnerships have been absolutely critical, at school and ESU folks working on those things. So so you can pay attention to the future ready stuff, and I think what Dorian put in the chat, I'm not sure if everybody can see it, but we'll get information out to everybody as well on that front. And so I really just kind of want to end on a little bit around the CARES Act, and we're probably a little short time, but the CARES Act overall on those particular funds that are going to be available, the governor has a certain dollar amount, roughly 16 million or so dollars, that can be used in the P20 space. And part of the conversations with him about using some of that for technology equity and equity in that space might be kind of one area that's going to be worked on. Obviously, schools are going to have access to CARES Act funds, and we're soon to send out a survey that will kind of give you some sense, both hopefully be informational to go through the survey, but also a chance to kind of give us a little bit of guidance before we submit a plan. Those plans to the federal government maybe right now look pretty open, but there's some back end stuff in the law that we're trying to make sure that we're paying attention to, so we don't end up having to do a lot of extra work at the end of that process. But just appreciate all those efforts, and we'll get more information out on that. Hey, I saw Jeremy Eshelman had popped in, and I didn't catch it when he came in. Jeremy is at Two Rivers, I think, is the right area. And Jeremy, I don't know if you want to kind of give a minute rundown on how things are going, as I know that you have quite a few cases developing in your area too.
Yeah, thank you, Commissioner Bloomstead. Can you hear me?
Yep, sure can.
Okay, fantastic. I'll take it a minute to win it then, because I actually have a call at 5 I need to get on to. So as of, this was data as of yesterday, we had 461 total cases. We're continuing to utilize the National Guard. What a terrific resource Nebraska we're able to use. We're positioning that Wednesday and Friday between Lexington, Gibbon, and Cozad. Our hot area in our district is in Lexington, Nebraska. As of this weekend, we had 53 cases on Saturday and 12 on Sunday. And a lot of the way our testing comes in, a lot of it's driven at this point in time by the National Guard. And obviously, the number of test kits they're able to procure. Our local providers do the very best they can, but they still are a little bit limited on testing in some ways. So as of right now, Dawson County has 357 positive tests, Buffalo County 88, Gosper County 8, and Gosper County is right south of Dawson geographically. Kearney County 4, Franklin 3, Phelps 1, and Harlan none at this point in time. Now, that being said, we're working vigorously to increase our testing capacity, and the governor's done a fantastic job getting additional tests out to us. And we're still not quite there. We're getting closer and closer to that. Something we're really excited to announce today is we have a state virtual contact tracing team. And we've talked about this a lot in public health, that it takes both the testing capability and also the contact tracing to make it all work. And so we have 21 people working today for the first time with the state of Nebraska helping us, just really moving forward to crank through people as quickly as we can. So we're really excited about that. As far as the directed health measures, there'll be additional guidance coming forward in the next few days. We're just really hopeful. I know there's a lot of changes that are underway at this point, but we know we have such a great group of folks in our 7 counties, and the people want to do the right thing. And we're getting really close to that point where restrictions will be lifted, and so maybe slowly transitioning out of lifted would be the correct way to say it, I guess. So. But we really appreciate the continued partnership with our school systems. We're just really blessed in our whole area to have such great school systems. So that's all I have for today.
Thanks, Jeremy, and thanks for your ongoing efforts, and just appreciate you being on too. So we'll probably talk to you tomorrow in that other call. So I will go ahead and wrap up. I see we got a couple more questions. I don't believe the governor was able to join. And so I have a couple of the questions really around his recent DHMs, and I'll kind of take those forward and see if I can get those addressed. I do think folks have kind of reached out to me and said the concerns around opening churches and how can we not open graduations as a result. I have not had the direct conversation yet with the governor on those fronts, so I will do that and see what I can address. And obviously, I think we heard from the local health officials, they're still pretty much on the same track of trying to sustain or lower the spread or reduce the spread of the virus. So I appreciate everyone, and hopefully we'll talk more later and have continued conversations. So thanks to all the panelists. Thanks, Andy. Thanks, Caroline. Thanks, Craig and Dan, and thanks to all our staff members. But we'll do this again, same time, same place next week. So thanks a lot, everyone. Take care.